What we realize for neuroanatomy is that although we've come a long way in our studies, for neuroanatomy we've come the wrong way. For most students, indeed, this is the case. Hello guys, welcome to Study with Kennedy once again. This is the second video in this series, how to study courses in medical school, and we are going to talk about neuroanatomy. As usual, the first thing I would advise you to do is do what your institution asks you to do what your lecturer or your professor asks you to do. And if you've already studied neuroanatomy and you're coming back to revisit this course, or you're looking to go through this course again, then this video is still for you. I think it will be helpful to you. What we realize for neuroanatomy is that although we've come a long way in our studies, for neuroanatomy we've come the wrong way. For most students, indeed, this is the case. The first thing I'll ask you to do is to go through images. Before you study the central nervous system, you want to know what the central nervous system structures look like. You want to be able to identify structures on the brain on gross view, at least. When you look at a section of the brain, you want to be able to identify what structures are. If I take a picture of the brain and I show you, you should be able to tell me frontal lobe, temporal lobe, occipital lobe. Those are basic stuff. When I take a section of the brain, you should be able to tell me this is the cingulate gyrus and this is the corpus callosum. Those are very basic things you should know before you even read the first line of your neuroanatomy textbook. So take the time, and I like the way the Snell's textbook is organized. There are images put right in front. Take time to go through those images as they are going to play a role when you begin to study the course. The next thing I'm going to ask you to do is to go through the basics, as always. I would recommend the first 3 chapters of the Snell's book. But again, I have put these 3 chapters into a slideshow, and they would be the first videos on the neuroanatomy series. If you're going to find it difficult to study those 3 chapters, of course, those slideshows are going to give you a very easy one to work with. You have to know basic definitions of words. If I say anesthesia, analgesia, paresthesia, whatever, quadriplegia and all that, whatever words and terminologies are used in the course of neuroanatomy, you should know them. You should try to master them so that you get a good command of the course, right? While I don't encourage you to bombard yourself with so much jargons, I believe that jargons actually build confidence, and they reveal your command of the subject. So it's going to be important sometimes to just know those big words. Instead of saying, oh, his hands are not working and his legs are not working, just say he has quadriplegia. Doesn't that sound nice? I think it does. You should understand the organization of the brain structures. Forebrain, midbrain, hindbrain, right? You should know what those structures are. Know where the medulla is, where the pons is, what the midbrain looks like on gross view. If you look at them, you should be able to know them. Another important thing from those 3 chapters that you should try to know is the relationship between spinal cord segments and vertebral levels. The relationship between spinal cord segments and vertebral levels. This is very important as basic information for your neuroanatomy. Now you know the basics. Let's talk about the chapters in the course. Different chapters of neuroanatomy, I believe, should be approached differently and studied differently. When you get to chapter 4, if you're using the Snell's textbook, I'll just give you, that's ascending and descending tract. You have to draw it to know it. Draw it to know it, right? When you describe ascending tract, draw the tract. Draw the tract. A lot of students have a problem when it comes to drawing, but the thing is, you don't need to be an artist to draw. Draw what only you can understand. That's enough. Right? You can draw what you alone can understand. There are certain things you should know if you're studying ascending and descending tracts. And I'll give you those points, but again, when you go to my video on ascending and descending tracts, you're going to see these points mentioned again. The number 1 thing you want to know is the origin of the tract. The number 2 thing you want to know is the termination of the tract, because this is how structures are named in neuroanatomy. If the tract originates in the spinal cord and ends in the thalamus, it's going to be called spinothalamic tract. If it originates from the cortex of the brain and comes to the spinal cord, it will be corticospinal tract. If it arises from the red nucleus of the midbrain and comes to the spinal cord, the cerebrospinal tract. So structures in the central nervous system are named according to their origin and their termination. You want to know this. For your ascending and descending tracts, you want to know the point of decussation. You want to know which tracts decussate at spinal level, what tracts decussate below at the base of the medulla, and all that. You want to know this information. These are the things that are going to be tested on the exams. The origin of the tract, the termination of the tract, the level of decussation of the tract. The next thing you want to bear in mind is the function of the tract. What does it do? Pain and temperature, pressure, vibration, 2-point discrimination, whatever the tract does. And then you want to know what happens when the tract is damaged. You want to know what happens when the tract is damaged. Those are the main information you want to know when it comes to ascending and descending tract. For each of your tracts, bear this information in mind, right? Bear this information in mind. Finally, you want to know the anatomic relationship of each tract to the other tracts. You want to know the anatomic relationship of each tract to the other tract. So how close is the corticospinal tract to the anterior spinothalamic tract? How close is the corticospinal tract to the spinocerebellar tract? How close is the corticospinal tract to the dorsal column? Looking at the image of the spinal cord. What this tells you, or what this helps you do, is know when you see a lesion, if something is affecting the dorsal column, is it most likely to also affect the corticospinal tract, or is it more likely to affect the anterior spinothalamic tract? These are basic information. You just want to have pictures of these things in your mind. I have covered all of these information I'm mentioning to you in my video series on neuroanatomy, so be sure to like and subscribe to this channel so that you get these videos when they are out. The brainstem is the next thing this Snell's anatomy textbook covers. So I'm going to talk about the brainstem. The brainstem can be studied in similar fashion as the ascending and descending tract. But for the brainstem, you must have a basic idea of what each component of the brainstem looks like. What does the medulla look like? A t-shirt. What does the pons look like? An upside down cone, right? What does the midbrain look like? Midbrain, a short, right? A pair of shorts. So you want to have an idea of what these structures or these components of the brainstem look like. And I think that is going to be very useful in your study of the brainstem as a structure. For other chapters of neuroanatomy, like the cerebellum, the basal ganglia, the limbic system, the reticular formation, and all that, while their connections are important, the function of the structures within these parts of the brain is more important for the examination. It is less likely that they would ask you the connection between the subthalamus and the thalamus. I'm not saying that really. It's less likely that they'll ask you for all those intricate details, which is what a lot of people focus on and get frustrated on neuroanatomy. When you talk about a structure like the subthalamus, I think the only thing you need to know about the subthalamus at this level of basic medicine is that when the subthalamus is damaged, the person has hemibalismus, right? That's all you need to know for the subthalamus. So a student that spends time working on drawing the connections to the subthalamus and all that is going to be wasting a great deal of time. So when you study the cerebellum, the basal ganglia, the limbic system, reticular formation, all those stuff, while you can give it some leverage, you can learn some of the connections, I think it is more important to know the function of individual structures. Another thing you want to know is their relationship to each other. What is the relationship of the thalamus to the structures around it? What is the relationship of the thalamus to the lateral ventricle? What's the relationship of the thalamus to other structures around it? That is another important thing. So two important things to note when you study these chapters I've just mentioned: their function, or the function of structures within these components or these parts of the brain, and their anatomic relationship to surrounding structures. If you're going to major in neuroanatomy, you want to be a neurologist, you want to be a neurosurgeon, of course, you're going to require to know all the details. But for someone that is studying basic medicine and wants to just pass the USMLE and the PLAB and all that, you're going to learn all those other information when you get to that point. At least know these ones before you get yourself frustrated. Okay guys, so much talk. Let's take a quick quiz. What's the name of the fiber bundles that connect the substantia nigra to the caudate and putamen, or to the corpus striatum? It goes from the substantia nigra to the corpus striatum. They are called nigrostriatal fibers. So again, the connections are not important because the name of the connection is the name of the origin and the name of the termination. Okay, substantia nigra to corpus striatum, nigrostriatal fibers. And in case you don't know, those are the fibers that are damaged or that lose their function in patients with what? Parkinson's disease, right? Parkinson's disease. Very good. Okay, number 2. That was easy. How about the fibers from the striatum to the globus pallidus? The nerve fibers that run from the striatum to the globus pallidus. What are we going to call them? Striatum is the origin, globus pallidus is the termination, striatopallidal fibers. You see, so you don't need to spend time trying to learn the complex connections in the brainstem. Their origin and their termination will give you the name, right? So learn the origin and the termination. The same thing applies to the thalamus and its connections. thalamocortical, corticothalamic tract, whatever it is, any connection in the brain is usually named like that. Of course, there are exceptions, like where you have your arcuate fibers and all those things. So when you go to those bridges, you will cross them. What are tegmental fibers? Okay, that's an outlier, right? That's an outlier. But tegmental fibers arise from the midbrain. That's an outlier. That does not have origin and termination. But of course, there are going to be exceptions. The exceptions are few, and remember, that's what they are, exceptions. They are not the rule. The exam, most of the time, is focused on the rule, not on the exception. The autonomic system and cranial nerves and their connections. When we get to that part in my series on those videos, I'll tell you how to walk through them. But trust me, though there are a lot, there's really a lot in those 2 chapters, there is an easy way to go about it. Okay guys, so we've come to the end of this video. Remember that the principles are what you apply to get results, right? The principles I've just given you for each of the topics I've mentioned really apply to other topics in neuroanatomy. These principles really apply to other topics in neuroanatomy. Make sure to click like, click subscribe. The next thing you're going to see on this channel are going to be a series on neuroanatomy. In between, you're going to have rapid review topics. I'm really excited to bring you rapid review. I'm really excited to bring you a series on neuroanatomy. These are the 2 best areas of basic medicine to me, even before pathology. But pathology is the most important anyways. Remember that. Okay, I'll see you on the next video. Click like, click subscribe, practice questions, practice questions, practice questions. If this video was helpful to you, please share with someone else. Let someone know that a revolution is coming to neuroanatomy.